We don't hear much about oral cancer, but it is a very devastating human cancer. Oral cancer encompasses cancer of the lip, oral cavity, and oral pharynx, and actually accounts for 3% of all cancers worldwide, and is now the 13th most common type of cancer in Canada. Early detection through routine screening is critical, and dental professionals play an important role in early detection. Limitations in the current gold standard for diagnosing oral cancer have led to a widely recognized urgent need for more effective prognostic biomarkers amongst the clinicians who treat both oral cancer and oral potentially malignant disorders. Survival rates for oral cancer have had no significant improvement in the last 30 years until now. I'm James Crane. On this episode of Care to Know, in my opinion, we are pleased to be joined by two very special guests. Our first guest, Dr. Barry Rennick, is a dentist as well as an oral and maxillofacial surgeon with a state-of-the-art clinic in Newmarket, Ontario. Dr. Rennick is actually the only dentist in Canada with dual specialty training in both oral surgery and oral pathology. Our second guest, Susan Colville, is actually a dental hygienist, and she's here to talk and share her story about her oral cancer diagnosis and the decision to use a novel diagnostic technology called STRATICYTE. So on behalf of our Care to Know consumer listeners, I really want to thank Dr. Rennick and Susan for joining us today and talking about oral cancer and this new test called STRATICYTE. Maybe we can start, Susan, with you telling us a little bit about yourself, and then we'll talk about, and we're fortunate to have you here today to talk about your journey through oral cancer, and then what impact STRATICYTE had. So why don't you start telling us a little bit about yourself?
Okay, hello, thank you. My name is Susan, as you mentioned. I have been in the dental profession for 32 years, and I've been working in private practice as a registered dental hygienist. I guess I'm proud to say I'm an oral cancer survivor, and I'm one of the lucky ones. I'm lucky because we found the cancer in the very early stages, whereas most oral cancers are found in later stages or more advanced stages with very dire consequences. So I would have never imagined, given my background, my education, and doing daily oral cancer screenings at work on myself, that I would be one myself to have gone through this experience.
Dr. Rennick, tell us a little bit about his practice. I already mentioned that you're a unique dental professional here in Canada, and you can expand on that. But tell us a little bit more about yourself and about STRATICYTE.
Well, I've been practicing oral surgery for 30 years or so. I practice in Newmarket, just north of Toronto. Although I practice oral surgery, I had a background in oral pathology, trained as a specialist in both. And so my practice has gradually evolved to be predominated by oral pathology cases. So I see tumors and cysts, and I see a lot of mucosal disease. And I see a lot of patients with cancer in my office, and also patients with pre-cancer in my office. And these pre-cancer patients are difficult to manage. We know that it's important that we diagnose or identify the high-risk patients so that they don't go on to develop cancer. And in the past, we've really done very poorly managing these patients. And there's a STRATICYTE test recently developed by Proteocyte Diagnostics, and this test measures the S100A7 as well as cellular morphology in patients that have OPMD or precancerous lesions. And we can now use that information to identify the high-risk patients truly, and then manage our care for those patients in an evidence-based way. Those patients that have high concentrations are noted to be high risk. We'll see them on a regular basis in the office and manage them aggressively. Those patients are not, well, they could perhaps be referred back to their family physician or their family dentist for follow-up. And everyone that has potentially a precancerous lesion does get taught self-examination so that we can keep on top of their care in a more effective way.
So, Dr. Rennick, as I mentioned in the opening of this podcast, that oral cancer is becoming a much more common cancer within North America and within Canada. What sort of steps are happening now to make improvements in this area?
Thank you. Yes, oral cancer is actually not as uncommon as you think it is. We've done very little to really make any impact on on the mortality and morbidity of this disease for the last 50 years. Why is that? Well, we're not identifying these patients soon enough. Why is it we're not identifying them? Well, we got to find the high-risk patients. And until recently, we haven't had a test which is objective and it's a really good cancer predictor based on a molecule that's instrumental in the cancer process. But we have that today in a test called the STRATICYTE test. It identifies those patients with pre-cancer that are going to go on to develop cancer. And if we are able to monitor these patients closer, treat them more aggressively, then they're going to do better. Better tests, better guidance, better outcomes.
So in the nutshell, STRATICYTE is better than the old gold standard in what ways?
Oh, absolutely. When I was taught, I was always told that dysplasia was the gold standard. Patients that had dysplasia were at risk of developing cancer. I was taught that mild dysplasia became moderate and severe dysplasia, and eventually that turned into cancer. We know that that's not true. I was told that patients that had minimal dysplasia were unlikely to get cancer. Those that had severe dysplasia got cancer. We know that that's not really true as well. And so we've had difficulties trying to identify the patients that are truly at risk. And this gold standard, unfortunately, has been what we've used to manage these patients for the last 50 years. We've needed for many, many years, people have been crying for an objective test based on a molecule that we can measure and that has high predictive value. And we finally have one in the STRATICYTE test that is currently available to clinicians, both in Canada and the States. This test is run by the Proteocyte company based on Hospital Row in Toronto.
And when did STRATICYTE become available for use by a dental professional like yourself?
The STRATICYTE test has been developed over the last 10 years or so, was only commercially available in Canada in the fall of 2022. And passed American regulations in the very early part of 2023 and should be available for widespread use, I would think, in the middle of this year, 2023, as the commercial rollout begins in the States. And the commercial rollout in Canada should be commencing soon.
With this new test, it just came into the market, as you just mentioned, for your peers who are dental surgeons as well. What's the excitement level like? Are they excited to have this new sort of revolutionary gold standard in their hands?
I think that Eric Dirks, head and neck surgeon in Portland, Oregon, probably stated it best that this is the holy grail that we've been searching for years. And anyone who has had any experience managing OPMD patients realizes the frustration that both the clinician and the patient have during the course of their disease. So this is a huge discovery. In the past, we've just been guessing. We've just been managing these patients blindly. Now we have some evidence-based management, and we know that a better test is going to lead to better guidance, and a better guidance is going to lead to better care, And if we can identify these high-risk patients, then we can start to make a real impact on the mortality and the morbidity associated with oral cancer. We'll be finding these patients at an earlier stage in their disease process, and many of the patients, their oral cancer that was developing we're going to intervene on those cases as well. So it'll be a huge impact.
Well, as you talk about patients, I want to move on to our second guest today, Susan. Well, once again, on behalf of our members, thank you so much to be here and sharing your story. Maybe you can start with what really led up to your diagnosis. How did all of this, start?
Righty. Well, it started with me noticing a sore on the right side of my tongue that lasted for more than 2 weeks, which I do know that should have healed by then. I'm also a tooth grinder and I wear a bruxism splint at night. So I was wondering if it was an irritant on my tongue wearing that. So I had my dentist look at it and he had a quick peek and thought, yeah, maybe we should send you for a consultation with an oral surgeon. And he just happened to know one that knew about the pathology as well. So I was seen by Dr. Rennick within a couple of days. And once he looked at it, he felt the same way I did, that it had the appearance of more trauma than anything else. And we thought we would get an adjustment on my bruxism splint as soon as we could, and we would go from there. Well, we had that done and it got slightly better, but it didn't go away. So within a couple of weeks, I was back in the office and I had a small intralesional injection of dexamethasone steroid, which is also used to help treat lichen planus. And even after the injection, it never completely went away. So we decided we were going to do a complete excision of this lesion and send it away for an assessment.
So that must have been a little bit anxious times waiting for some results to come back. Maybe you can share with us how that sort of took place.
Well, I heard back within a week to 10 days. And lucky for me and Dr. Rennick, we were very pleased that it was what we suspected. It just was interpreted as a traumatic ulcer and it wasn't cancer. The pathologist, however, did say that it had some atypical cells present in the biopsy and it should be watched with caution. A week later, that lesion was reoccurred again. So again, it was removed and biopsied, but this time I was not so lucky. I heard from the oral surgeon within about 2 days. And as soon as I saw the phone number come up, I thought, this is not good. And I was not lucky. I was told those 3 words no one ever wants to hear: squamous cell carcinoma. I had oral cancer. I was fortunate, however, that the oral surgeon did excise the lesion with enough adequate borders that the cancer did not reoccur. For that, I'm thankful for.
So where did STRATICYTE then come in? You heard about it. Dr. Rennick brought it up. How did that come about?
Well, following each surgery, I was, of course, very sore, and I always was worrying if it was ever going to come back. You always had that in the back of your mind, that why is this happening to me? When is it going to end? Every time I'd go see one of the surgeons or down to the cancer center, it was like, oh, well, now let's see what's going to happen this time. And I couldn't understand why it was happening to me, especially given that I don't fit any of the risk factors. I'm a non-smoker. I've never smoked. I drink very little alcohol. I'm in good shape. I take good care of myself, and being a dental hygienist, I'm always excellent care of my oral cavity. But I think it was probably late 2019 or early 2020 when I was asked by the oral surgeon to be part of the STRATICYTE test, which STRATICYTE test was what determined the progression to cancer of clinically suspicious oral lesions.
And tell us, or walk our listeners through, when you took the test, what happened next?
Well, he explained to me what it was about, and that in simple terms, that it was going to measure the cellular content of cancer-associated protein in the biopsy specimens that were already at the lab. If it had a high count, it was not going to be favorable for me. And if it was a low count, the cancer had a less chance of it reoccurring. And fortunately for me, both of my biopsies showed the STRATICYTE test the numbers were falling. And I thankfully have been cancer-free now for 3 years. I can say that, thankfully. And I think the STRATICYTE test really relieved a lot of my anxiety. I felt very grateful to be part of the STRATICYTE test, and I consider myself very lucky.
Well, congratulations. And you, Dr. Rennick, was Susan one of the first STRATICYTE patients in Canada?
Well, she wasn't one of my first patients. I wish I had seen her a little bit earlier. We were fortunate in that when Susan's cancer was removed, that we managed to get it all, and she didn't need any further cancer treatment. But she did have recurrences afterwards, and she had a half a dozen or so excisions of portions of her tongue after her cancer surgery. And if we had had STRATICYTE available, maybe a little bit earlier in that process, we may have been a bit more aggressive earlier, and that would have prevented some later surgery. So it was unfortunate that it was later in Susan's history that STRATICYTE really became available for her.
Now, Susan, once again, thank you for sharing your story. Any words of advice for our members who are listening about how to detect oral cancer and maybe, what they can do to be as effective as they can dealing with their dental professional?
Well, I think Dr. Rennick summed it up very nicely at the beginning, and that was, if you're not sure what it is, to get it looked at and make sure you have a referral. But yes, definitely, I think it's important to keep your regular appointments with a dental professional, and hopefully they are doing their intra and extra oral exams to catch these things in early stages.
Dr. Rennick, just the STRATICYTE you mentioned earlier is newer in Canada. Words of advice for our members: should they be, if they do have some concerns, mentioning this test specifically to their dental professional, just to make sure that they do have an opportunity to potentially use it?
Well, I think that most dental professionals are going to be more aware that the STRATICYTE test is available in the coming months as the commercial rollout begins. This test is tried and true. It's got a great, we've got great data on this test. It performs as well as many of the other diagnostic tests that are out there, that cancer predictive tests such as Afirma and MammoPrint. And we should make use of the information that we have. In the past, managing of oral precancer patients has really just been a bit of a guess. Let's take the guesswork out of it.
And Dr. Rennick, if any of our members want to learn more about STRATICYTE, is there a website they can visit or anything else in terms of a resource to find out more?
If our viewers go to the Proteocyte website, you'll find information on people who are involved with this project. You'll find information about the STRATICYTE test and how it works. Find information on how to order the STRATICYTE test. You can download a TRF, a treatment request form. And there is also a portal for there's a portal for physicians that they can access our research library. And there's also a portal for patients if they want to know a little bit more about the STRATICYTE test, but in terms that they might be better to understand, then that's available for them as well.
Well, we'll make sure we have those links available to our members on the email as it's deployed with this vodcast. But on behalf of our Care to Know membership, I want to thank Dr. Rennick for a great overview of STRATICYTE. And obviously, you've got some significant expertise in this area. And Susan, thank you so much for sharing your personal story with us. I'm sure it's going to ring true with many of our members. And on behalf, once again, thank you for your time today.
Thank you for having me.